We are delighted that you're joining us for another podcast of Wake Up Aligned, and it is the podcast for chiropractors, where we get to talk about chiropractic lifestyle, and topics of interest. You can contact us through our email, and that is mailbag@amcfamily.com. Welcome back to Wake Up Aligned. I am your host, Dr. Shannon McMurtry, and we have our second parter today of a two-part series on comparison. So if you have stumbled upon this one and you're hitting this one first, I would please recommend you go back to the platform on which you listen to these podcasts, search out comparisons number 1, and start there. That way you'll be up to speed with everybody else, and this can be as relevant to you as possible. We spent that first episode talking about comparisons, and in our system, we're trained to do that. And we talk about comparison in terms of cost, typically consequences, maybe treatment. You know, we get into some of that. Even people who are trained to do it, though, honestly, don't do it regularly. So I think some people are uncomfortable with it, and there are people who don't do it well, and they don't do it enough. So that could be a standalone recommendation for you. That could be something that is really worth the price of admission to these podcasts. But going deeper, going more detailed, learning about the journey someone takes. How long did you wait for that appointment? How long were you sitting in that appointment? What did the person you spoke to tell you to do? Okay, and how long did it take to get those things done? What was the cost to get that advice? What was the cost associated with those other things that you were supposed to do? How long did you wait for that? How long were you there? What did they tell you? How much did you spend? And then just go through every part of their journey like that. So today we talk about taking that concept of comparison and introducing it to your staff. I love chiropractic assistants. Not like that, though. I love chiropractic assistants for their heart and their desire to see people helped. Because when I talk to doctors and I talk to the assistants at our summit meetings, there's a passion for helping people that the assistant has that even the doctor sometimes is lacking. And you would think it'd be the other way around. The doctor is the one that's got the education and spent all the money and the time and investment to, be part of this healing profession. And yet for some, it's the staff that have a bigger enthusiasm for helping people than the doctor. Well, if you're not nurturing that, if you're not nourishing that, if you're not building into that, you need to. So let's talk about those comparisons and marrying that to your team, and then finish the conversation with the cultural impact. To do this properly, you've got to have a patient that meets some criteria. Because what we're going to do is invite this particular patient to our weekly staff meeting. I hope everybody here is having a morning staff meeting, and I hope they're having a weekly staff meeting that is longer, more detailed, more about training and troubleshooting and solving problems before they ever show up. If you're not doing those, this is your reminder to do those. But we're going to invite that patient. Our fictitious patient is named Marjorie. We're going to invite that patient to our weekly staff meeting so that the team can interview her. See, you learned about Marjorie, doctor, in the consultation. You know a little bit about the journey. Maybe you haven't thought about it as in depth as what we did. Maybe you really didn't think about dignity and other things, but you know a little bit about the journey. Your staff typically is completely unaware of that. So we want to invite Marjorie to the staff meeting. Marjorie's got to have 3 primary characteristics to be a candidate for that. Number 1, Marjorie has to have a pretty significant journey, spinning her wheels trying to get care on her problem before she ever stepped foot into your office. If she doesn't have that first criteria, she doesn't have anything compelling to share. There's nothing to compare. Number 2, Marjorie has to be the type of person that is willing to share and willing to talk. Some of the questions that we ask might be embarrassing, not to embarrass Marjorie, but because we're going to talk about some things that sometimes we don't like to talk about. So if Marjorie is very reserved or closed off or very short with answers, she just has that type of relationship with you, I would not invite Marjorie. I don't think that's going to do anybody any good. And then third characteristic is she has to have a schedule. Marjorie has to have a schedule that meshes with your schedule for when you're doing staff meetings. If she's working while you're doing staff meetings or picking up the kids from school or whatever it may be, she might not be a candidate. Unless you could have a special staff meeting earlier in the day, later in the day, to interview this patient. So those are the 3 criteria. If Marjorie meets all 3 of those, Marjorie is a candidate to come in and do an interview in the office. Now, you can't do this every single staff meeting. That would be overkill. But I think it would be completely appropriate to do this about once every 10 to 12 weeks. So you'd like to target about 4 to 5 staff meetings in a 52-week year, where we're going to invite the patient who has a significant journey to a staff meeting for interview. Doctor, your job is to not lead the interview. Your job is to set the frame, establish what we're doing today, maybe prime your staff with some questions to ask, especially if we're doing it for the first 2 or 3 times, right? You have to develop a rhythm and develop some comfort with it. The first one may not go so well. But your job is to not lead it, doctor. Your job is to facilitate it. So, I'm the doctor. I'm talking to Marjorie. Marjorie, you have a really amazing story. It's not a great story in terms of results and you getting healed, but you have an amazing story of what you endured before you ever stepped foot into my office. My staff needs to know what's out there. We don't know. We're ignorant of that world. This is the only world that we know. We're all under chiropractic care. We're relatively healthy, for the grace of God. Thank you, right? But we need to hear from you, Marjorie. Would you mind joining us at a staff meeting so we could interview you about your journey? I'll bring some lunch. I'll bring some snacks if I'm catching you between work and home. Marjorie says, well, I've never really thought about that. Well, I understand, Marjorie, but it would really be helpful for my staff to understand what we do compared to what people are going through. Marjorie relents. Yes, okay, I'll do it. All right, we're going to have our staff meeting next week. Would that be, all right, got all the logistics worked out. Now I'm going to go to my staff and say, hey, staff, Marjorie's going to join us at our staff meeting. We're going to have a special staff meeting next week. We're not going to talk about business and training and protocols and the problems of the issue and the issues and all that. We're going to talk to Marjorie. And we're going to talk to Marjorie about her journey. We're going to interview her about her journey before she ever came to our office. Now, here's the interesting thing, doctors. You don't necessarily have to have a patient who's gotten great results in your office yet, because we're not really concerned about her results. We're concerned with her story before she ever came in. We're concerned with what she has endured before she was your patient. If she's gotten results in your office and that facilitates her being agreeable to this or, willing to share because she's compared, great, but it's not a prerequisite. So we tell the staff what we're going to do. We're going to interview. We're going to do this. We're going to ask questions to Marjorie and be prepared for that next Monday on staff meeting. Monday rolls around. Marjorie shows up. If possible, if allowed, if you can do it, and if Marjorie is comfortable, I would highly recommend you video record the interview. But don't record it where Marjorie is exposed. We have to keep her anonymous. So maybe it's from the lips and the chin down. Maybe we interview Marjorie and the camera is kind of to the side and to the back where she's a bit silhouetted and you can't really make out any facial features. Staff can be on there. You can be on there. We don't care about your anonymity. We care about Marjorie's. But video record this. Assure Marjorie, hey, your face will not be shown. You will be anonymous. And if there's any part of this that you do not want us to share in any way, we will not. Right? You give her safe space for that. But you'll understand, if you haven't already, if you've not already connected the dots, you'll understand why that could be a very valuable tool as we do this. So we're there. We've got the video set up. Everybody's got their sandwiches and whatever. And now we're ready to get going. So, doctor, we say Marjorie's here because she has a story of chasing this problem and enduring just a whole boatload of stuff. And you as staff, me, we don't know this world. Chiropractic is all we know. So we're going to do an interview. Who would like to start? And doctor, if you need to start, you start. But don't take over. And we want to ask questions like, how long did you wait for this appointment? How much were you suffering as you waited? What was that doing to you, like from a mental health standpoint and a hope? How frustrated were you? How long were you in that office? What did they recommend to you? How much did that cost you? Those recommendations, how long did you wait for each of those? And how long were you there? And what was that like? Were you claustrophobic being in the MRI machine? Did you have to have someone driving you to and from for your pain management? Did the physical therapy make you sore or hurt? Did you like where you went? Were they nice to you? See, we should talk about the whole experience, the whole journey, not just the cost of it, not just the treatment, not just the consequences. Marjorie, as you were going through all this, do you work? Who was covering your work? Were you allowed to miss work? Did you have to take family leave? Did you have to take sick days? Were you getting paid time off? Did you just miss work and not get paid? Were you able to pick up the kids, take them to their games? Who was doing the shopping for you? Were you able to shop? Marjorie, what kind of things were you looking forward to doing that you didn't get to do? Like, do you and your husband go on date night? Do you like to go Saturdays to the park with the family? Did you have any special trips planned that you couldn't do? What were you doing in the house? Were you able to do your chores? If not, who was doing those for you? How did that make you feel to watch them have to cover your burden, cover your load? And if the problem is of a nature where it might be difficult to ambulate or go to the bathroom or take care of oneself, Marjorie, what did it do to you for your family to have to bring the food to you in bed and help you out of bed to go to the bathroom? You couldn't stand in the shower by yourself? Who was holding you up as you were showering? How did that make you feel? Were you nervous about falling? Were you at home by yourself at all? And in a bad way? Did you have to go to the bathroom by yourself and not able to do it? Marjorie, I don't want to be too, I don't want to pry here. I don't want to be too overstep my bounds, but how were you able to go to the bathroom by yourself? Ask the questions. Because it's not just about the cost and the treatment. It's about the engagement. It's about the burden. It's about the dignity. And if Marjorie is willing to share, the stories that she and these other patients will tell you and your staff will absolutely break your heart. And you will be brought to a point of awareness, an awareness that you've never even considered before because it's not your world. Here is my proof in the pudding story that will bring this home to you. My raving lunatic fan in my office was was the wife of a patient. I never adjusted this lady, but she was a raving lunatic fan because she worked for 40 years as a nurse who specialized in orthopedics. She came in those first few visits with her husband, arms crossed, mouth drawn up in a knot, no eye contact. She did not want to be in a chiropractor's office, especially in the middle of the day where somebody might see her car. And after her husband started to get results, her whole demeanor, her whole attitude changed and transformed. And she told everybody about us. Now, why? Was it because her husband had such a complex case and had such an amazing recovery? No, he was in his 80s. There were very limited things we could do for that man long term relative to what we were doing for other patients. You know why she was a raving lunatic fan? Because she saw every day for 40 years the difference in that orthopedic pathway and what we were doing. To see her patient her husband, my patient, to see him be able to engage with life, to not have people rendering care to him 24/7, not laid up in a bed, able to go to the bathroom, able to bathe himself, able to get to the kitchen, able to get out into the yard and garden, and able. When she saw that, and she compared it in her mind to 40 years of the other, she was blown away. And if you've ever had a nurse as a patient, you will find that they are your biggest fans, many of them, because they see it every day. They see a world that you and I are oblivious to. They're making the comparisons. All right, let's get back to Marjorie and the interview. So we're going through the interview process. Maybe it takes 30 minutes. Maybe it takes the full hour. Maybe it's a short one and it's 20. I don't care. It doesn't really matter. Right? We're done with the interview. Obviously, a lot of gratitude to Marjorie. Hugs, kisses. Thank you so much. We're so honored that you were able to share that with us. We really do appreciate it. Send her on her way. You better believe Marjorie gets thank you notes from everybody on that team that next day. You better believe that we talk about that after the fact. We do a debrief as a team, maybe the next day if we're running late. There's going to be 3 immediate benefits to that moment, that interview moment. Let me share them with you. Number 1, the patient will think about where they were before they ever came to your office. My mentor taught me that you can never lose taking a patient back to where they were, because the patient is making a comparison to that journey compared to, even if they're not getting results, the hope they have of results in your office. So that's the first benefit, and it's immediate. Second benefit is your staff is brought to a level of awareness. Awareness precedes conviction. Conviction precedes culture. So now they're seeing a pattern and they're seeing what's real out there, things that maybe they've never even thought about before. And then the third is you, the doctor, are benefited because you're seeing a profile. You're seeing what's reality. You're maybe for the first time in your life understanding the difference between what you do for people and what they have done for them elsewhere. And now that increases your resolve. We were taught, and I tried to do this as a young chiropractor, we were taught to say, hey, if you've been saving for a rainy day, well, it's raining. You know, I tried that and it didn't work. I got the words right, but there was no belief behind it. There was no conviction behind it. So it all fell flat. Knowing what I know now, after 25 years, thinking about these comparisons, hearing what my wife has to say about rehab at the hospital, do you think that I could say those words with conviction now? You better believe it. So that's where you benefit, doctor. You may be able to say the things that you were squeamish about. You may be able to say the things that didn't feel like they were real and say them in a way that are much more convicting now than they've ever been. The fourth benefit is the cultural improvement. When you have an office culture that is healing, that is health, that everybody's rowing in the same direction, it is a very special gift. And it's something that can be cultivated. It's also something that can be completely lost. So we want to cultivate it. We want to nourish it. We want to sustain it. When I started off, I was a big fan of training. Do this, don't do this, say this, don't ever say that. And there's value there, right? I don't want you to think that we just shoot from the hip, because you don't want to be shooting from the hip in healthcare. But I have evolved in my thinking about training. If I had to choose between culture and training, keep in mind, I was the training man for years. If I had to choose between culture and training, I'd choose culture. Ideally, I'd like to have both. I like to have culture and training, right? This is what we do. This is how we do it. And if the patient or the situation gives you a curveball, these are the common curveballs. This is how we handle. I definitely think that's important. You don't want to ill-equip someone to lose in the moment or not win in the moment. But I'd like to have both culture and training. So let's pretend we've done this several times. We've had our interview. The culture is changing. The conviction is increasing. People are much more aware of where they stand in your office. I'm talking about your staff and what we do for the patients relative to what's outside the office. Imagine the patient. This patient's now, his name's Zach. Imagine Zach coming to the moment where it's time to present the plan and then go over all the details, the logistics, the dollars and the time. And doctor, if you're passing off that conversation to the staff, sometimes your staff sits down with Zach and Zach says, wow, that's a pretty big commitment of money there. I'm not sure I can afford that. Now, training says if the patient is to say that, then we have a response to it to try to work the numbers a bit to get it down to a budgetable payment. And that's good. But what if the staff had that training and an awareness, a conviction about the dollars spent inside the chiropractic office working towards a solution compared to the money spent outside of the office? Remember in our examples, we're talking about $800 compared to $8,000. So Zach sits down and says, I'm not sure I can afford that. And then training and culture come together perfectly. And the staff says to this patient, not because you told them to, but how could they not, given what they know? Staff says to Zach, well, listen, we can look at the numbers. We can look at maybe extending the amount of time and get it down to hopefully a budgetable amount for you. But Mr. Zach, based on what I've learned about patient care inside of the office and outside of the office, if money is a concern for you, you don't have a lot of options. Because pennies spent in here saves you dollars chasing the problem outside of the office. Like we've spoken and interviewed patients who have spent tens of thousands, hundreds of thousands of dollars and are still no better. They're coming to us after all of that. So I'm not trying to scare you. I'm not trying to, force you to do anything. Your budget is your budget. I respect that. But if money is an issue, you need to carefully consider what this does for you compared to what it would be outside the office. Oh, and that's true too, guys, ladies. That's so true. A patient that came to me years ago was self-employed, a tradesman in the construction industry, had a hip problem, simple problem, very easy to fix, responded well with our test adjustment, but couldn't afford the care. His mom, who was also a patient, he was an adult man, but his mom shared with me about 6 months later that he had hip surgery and he went bankrupt. I'd like to have that one back. You understand? I'd like to have that one back, knowing what I know now, being convicted the way that I am now. What if that was your staff? What if that was your well-trained staff who had a real desire to help people, and now they are knowledgeable and convicted about what's it like outside the office? All right, so now we're back in the scene where Mr. Zach doesn't have a money obligation, but he's a very, very busy man. Oh, it's harvest season up here. We're doing inventory this season. I have so many things to do that take me away from my home and blah, 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 blah. That's a long time. I'm not sure I can commit to that much time or that many times per week. Here we go. Culture meets training again. Staff says, well, Mr. Zach, I'm not authorized to make any kind of changes to your treatment recommendations. That the doctor would have to agree to that for you. So I'll go get the doctor. But if time is really an issue for you, based on what I've learned about patient care outside of the office, minutes spent in here saves you weeks outside the office. Like, patients are typically beginning to turn the corner in a couple of weeks. Spend about 3 to 4 hours with us total. Outside the office, it could be 6 months, a year, 2 years. So, Zach, your time is your time. You're going to have to make a decision, but I want you to be thinking about it properly, because your problem's not going away. You're going to have to do something. I'll go get the doctor. Imagine coming into the room, the doctor, with that being left, just hanging in the air for the patient to consider. Now, does that mean all the patients are going to take care? No, people are going to make bad decisions. You have to respect their autonomy to make good decisions and bad decisions. It's going to happen. That's not a sales technique. That's not something to close the deal. And if you're thinking that way, back the train up, Buster. It's not intended to do that. It's intended to be truthful and help your patients understand you just had a near miss on the road. You just passed an accident in the ditch. Consider that. Think about that. Because it's not all rainbows and roses outside the office. And it's not. If you can do that very simple recommendation and bring some consistency to it, don't make it a flash in the pan. Don't make it a one-off. Don't get hot on this for a few weeks and then do it and then drop it because some other fire showed up. If you will develop and invest in your culture, there will be moments like that. There will be moments where patients are trying to cancel their appointments because they're too busy. Mr. Smith, I do not want to see you cancel. I can't change your appointment schedule or your treatment schedule by the doctor, but let's not take a chance on you going backwards. Let's not take a chance on you ending up like some other people have ended up. What if that was what she was saying? Not because she was trained, but because she was compelled. What if now she understands the story of Marjorie and she pulls Marjorie aside one day in the office and says, hey, Marjorie, we have a new patient here, Mr. Zach, and you guys had a very similar thing. He just didn't have your journey before coming to our office, but he's kind of in a bad way. Could you give him some hope? Would you mind sharing with him your story of where you started and how well you're doing? All right, awesome. I'll go introduce you. Mr. Zach, hey, this is Marjorie, and I just asked her if she wouldn't mind sharing her story with you because you have a lot of similarities. Now the staff is doing it not because they're trained, but because it's real and it's authentic and it's culture. And there's multiple areas of benefit where you go from do this because I want you to do it or I'm training you to do it to do this because it's the right thing to do. You think your clinic would benefit from that? You think your service to your community would benefit? You think the attitude and the appreciation from your patients would increase? The answer is yes to all of it. So it's a simple recommendation. We're just starting to see some people bring this to their staff, and the staff is very, very motivated to go down this path. Hopefully we can keep you updated as other results come in. But I have really enjoyed being with you today. Would love to hear your feedback. Mailbag at amcfamily.com. You like what I'm talking about? Let me know. You disagree? Hey, let me know that as well. Most importantly, if you have no idea where to start, how to do what we're talking about, contact us and find out if you are a candidate for what we do. We would love to have that conversation, and there's no pressure and no obligation. Thank you so much for joining me. I hope this two-parter has been something that is impactful for you, your career, your staff, and most importantly, those patients that you serve. Until we meet again, God bless. Follow our show. You can share it with friends, of course, and we'd love for you to contact us at mailbag@amcfamily.com. In addition, you're always invited to attend or join us at a summit. Of course, registration is required. And we would love for you to check out the loads of free content we provide to social media every single week. Until next time.